Welcome, everyone. Welcome to the Brain Health and Wellness Innovative Series. Tonight, our presenter is Dr. Dennis Grossman, and he is presenting on diabetes, diet, drugs, and dementia. My name is Cassie Fazekas, and along with my colleagues, Nicole Hale and Hannah Doles, we provide care navigation in the JFSA Dementia Care Navigation Program. Our program establishes an empowering environment to help improve the quality of life of those who have dementia or are at risk for developing dementia, while helping family caregivers reduce stress and burden that often occurs while caregiving. At JFSA, we understand the importance in working with our clients' strengths and applying a person-centered approach to care, which extends throughout our multidisciplinary team of geriatricians, nurses, social workers, and geriatric psychiatrists. Nicole, Hannah, and I meet our clients where they are at and develop individualized care plans to help produce solutions to presenting problems. From linking persons with dementia and their families with community resources to following them with their medical management, we are their point of contact for guidance as well as a listening ear. We consider the intersectionality of one's life when creating interventions that adhere to their biopsychosocial needs and experiences. And while using Zoom tonight, how to ask a question during the webinar, please click the question and answer button, the Q&A button in the Zoom webinar system. Type your question in the Q&A box and submit it. Please do not submit a question using the chat button.
Just it. Yeah. Oops. Oh.
JFSA is pleased to offer continuing education credits. Please note it will take 30 days from the date of your application, once you complete the survey, to issue your continuing education credit. Your CE certificate will be emailed to you at the email address you provided during registration. The email address that you use to access the webinar must be the same as the one you are providing. Entering a different or incomplete email address will prevent your CE from being issued. If you are unsure, check the email you got this on. And to introduce Dr. Grossman, Dr. Grossman is a graduate of Case Western Reserve University School of Medicine with over 30 years experience in internal medicine. I'm just going to turn this off. It's distracting. He has been on the staff of University Hospitals, Bedford and Ahuja Medical Centers, Cleveland Clinic, South Point, and Marymount Hospitals, Metro Health Medical Center, former medical director at JFSA, and a clinical instructor at the Case Western Reserve University School of Medicine. For the past 30 years, Dr. Grossman has been interested in the effects of diet on chronic Western diseases and promoted plant-based diets and a macrobiotic diets. Dr. Grossman believes that they play a key component in preventing and reversing some types of diabetes, hypertension, heart disease, stroke, and degenerative joint disease. And I'll leave it to you, Dr. Grossman.
Thank you, Cassie. So it is an honor and pleasure to talk with everybody, and I hope that this raises some questions. I'm going to try and simplify the topic. I think I probably bit off a lot, but the title is Diabetes, Diet, Drugs, and Dementia. And what I'm trying to do is tie these things together in how diet, diabetes, and also the newer medication that science has produced affects the ability to to deal with cognitive decline. So there are two key factors, and this is, if you take nothing else away from this, these are the two important factors. Two contributing factors to cognitive decline are chronic inflammation, which inflammation is part of our immune response. And when we have chronic inflammation, it's kind of an impairment, a hobbling of our immune system. And then the second concept is called insulin resistance. And insulin resistance has to do with the inability of our cells to respond to insulin properly and to allow the brain to utilize glucose properly. And these two are actually linked together. Insulin resistance is an inflammatory situation, and chronic inflammation will create worsening insulin resistance. And I'll get into the details a little bit, but these two factors, they may be foreign to you, but I'm going to try and explain them in a way that shouldn't be too difficult. So what is inflammation? What is insulin resistance? And how do these two states relate to dementia? These are the questions I want to answer. And also, what can we do about that? So inflammation is really a state where our body is alerted to something in response to an irritant. And I'll list a multitude of irritants. And they can come from the outside and they can come from the inside. And we do have this inflammatory response so that we can face things that are foreign to us, things that are irritating, things that we don't want to affect us. And once that is conquered, then we should go back to a state that is a normal state. And the term homeostasis really means returning back to a normal state. And when we have chronic inflammation, this really interferes with the ability of the body to return back to its natural set point. So homeostasis, which is another term that I guess I should have added, is really critical in terms of how we have a healthy body and how we can deal with anything that comes along. What's even more specific is that inflammation upsets which upsets homeostasis, is of the hypothalamus, a part of the brain, a primitive part of the brain, which is key to maintaining homeostasis. The hypothalamus is very key to regulating our metabolism and our temperature, and also just how we grow and how we work the intricate parts of our body. Inflammation in the hypothalamus, we have found out, precedes insulin resistance, obesity, and diabetes. If we can turn off that inflammation, we can help maintain homeostasis. So the hypothalamus acts to match energy intake to energy expenditure to prevent excess accumulation of stored energy. Excess calories or high saturated fats can cause inflammation in the hypothalamus. The other thing that can cause indirectly inflammation in the hypothalamus is something called dysbiosis in the oral or intestinal flora. So in the gut and in the mouth, if the organisms that are there, and there's 100 trillion organisms, but if those organisms, for some reason, are pathologic or they're overgrown, they will cause a chronic inflammatory state. Systemic inflammation can lead to cognitive decline. And factors that lead to this enhanced inflammation, chronic inflammation, are, as I mentioned before, either intrinsic factors. So it could be a chronic disease state like autoimmune. It could be diabetes. It could be vascular disease. It could be obesity. All of these are inflammatory states. And then there are external factors, toxins that we may be exposed to, microbes, inflammatory foods, as I mentioned, oral and gut dysbiosis, and some vitamin deficiency states. So whether it's intrinsic or extrinsic, the body is out of homeostasis when it has chronic inflammation. And here's a pictorial view of all of these things in one way or another. And I've thrown a couple others in: allergies, infections. All of these things will create a state where your hypothalamus becomes inflamed. And when it becomes inflamed, it is unable to do its job of returning the body to homeostasis properly. So, neuroinflammation. Well, we know that diabetes and obesity are pro-inflammatory states. We also know that diabetes, prediabetes, and obesity account for over 50% of adults in the United States. And type 2 diabetes is associated with a 60% increased risk of dementia. So let's go to the second topic, which is insulin and insulin resistance, because that really ties into diabetes. And how this really ties into neuroinflammation is that the hypothalamus is actually part of the system that regulates insulin and the ability to utilize carbohydrates in our body. We have an elaborate hormonal system that senses the intake of nutrients and manages the utilization, the storage, and it also maintains a narrow range of sugar in our body. The central communication hormone is called insulin. However, if there's inflammation in the body, especially in the hypothalamus, this can disturb the communications between the hypothalamus and the pancreas, can lead to metabolic defects such as obesity, metabolic syndrome, and diabetes. So how does it function? Well, it's secreted by the pancreas in response to dietary carbohydrate loads. And it affects the liver, the muscle, adipose tissue, and the brain. It senses the caloric intake. It senses also the need of the body, and then it directs the body to store or to utilize these food substances. It responds to elevated blood glucose, blood sugar. Now, the metabolic task is to allow the glucose into the cells for energy production and also for energy storage for future use as fat and also as glycogen, which is a carbohydrate storage. But it also is anabolic. That's a term that has to do with growth. And it helps in growth and cell division. And this actually can lead to some vascular dysfunction by growth inside the blood vessels. It can also affect cancer growth. So the effects of insulin are double-edged. It lowers the blood sugar, but it is also an anabolic hormone that increases the growth of smooth muscles in the blood vessels. And so the circulation to the kidneys, the heart, and the brain may be compromised due to this increased endothelial growth. That's why the sugar level, if it's maintained properly, is ideal and will prevent some of these untoward side effects of excess sugar. Glucose is the preferred brain food. It is the energy supply that the brain craves. Although when there is a lack of glucose, the brain can also use ketones, amino acids, short-chain fatty acids, and lactate. As we age, the number of insulin receptors decline. And diabetics have been shown that they can improve their cognition by using intranasal insulin, which is a direct stimulant to the brain to be able to utilize glucose in the brain. But as we age also, we have decreased muscle mass, and skeletal muscle is the main glucose absorber. So as we lose muscle, there's less absorption. There's more elevated glucose in the blood, triggering hyperinsulinemia, chronic high insulin. It's the body's response to nutritional oversupply. Chronic, highly refined carbohydrates lead to chronic high insulin levels. Not in all people, but in the vast majority of people. And at some point, in many people, these high insulin levels lead to insensitivity at the cellular level, or as we refer to, insulin resistance. So high insulin levels lead to elevated blood sugar, and dietary choices usually are the things that lead to high insulin levels. Excess calories, ultra-processed carbohydrates, excess saturated fats, and elevated omega-6 to 3 ratios in terms of the fats that we eat. And I'll explain that in a bit. So all dietary nutrients are really naturally inflammatory. And the reason for that is they're foreign substances. They enter in through the gut, and they need to be metabolized into biological material or converted to energy. And the initial step in that is to identify them, break them down, and then either utilize or discard what is not necessary. And there are foods that are inflammatory, and there are foods that are anti-inflammatory. But we do know that if we intake excess calories and inflammatory nutrients, these may generate inflammation, and the ability of insulin to orchestrate metabolism becomes compromised. And that leads to this term insulin resistance. Inflammation of the hypothalamus, as I said before, leads to insulin resistance. And there are two main problems. Number one, if there's decreased insulin receptors in the brain, which we have as we age, and this lowers the available glucose as the main food source. The brain has 2% of body weight, but it uses 25% of oxygen, and that oxygen needs energy to be burned. And two, storage of excess calories starts to shift to the liver and to visceral organs instead of to the fat areas where we want it to be. The end result is the loss of control of glucose metabolism and storage, and the loss of homeostasis. How does it affect cognition? And I think I've only given 3 ways, but it says 4 ways. So low-grade inflammation can lead to insulin resistance directly. We've seen that when insulin is less effective, there's less glucose available as the brain nourishment. Also, inflammation diminishes the blood-brain barrier's protectiveness. And so that more material that's foreign and maybe inflammatory to the brain will also accumulate, thus decreasing the brain's capacity to function. And the final thing is that high insulin levels overwhelm insulin degradation factor. So insulin degradation factor is actually what the body uses to break down insulin, but it also breaks down amyloid beta. Amyloid beta has been linked to Alzheimer's disease. So you have less insulin degradation factor left to deal with any amyloid that's accumulating. And thus there's buildup. How do we get to this state? Well, so I'm going to shift gears here. 2 most important contributors. The first is the industrialization of farming and the processing of our food supply. And the second is the good old medical community, which supported the theory that high cholesterol leads to heart disease. So let's look at these two. Well, industrialization of food, changes in our food. We have added sugar and refined carbohydrates to many foods. We have had an introduction of industrial processed vegetable oils, which are saturated with omega-6 oils. So, in order to process vegetables into oils, you have to use chemicals to break them down and then create the oils. This practice started in the I'd say 1920s and 1930s, and it just accelerated. The first product that they were able to achieve it with was Crisco. I think people can remember that. And these vegetable oils are hard for the body to deal with. Plus, they contain a lot of omega-6. So omega-6 just refers to an omega conformation at the sixth the sixth carbon. It's really just a marker, but omega-6s are pro-inflammatory. We do need them, but there's been an excess of omega-6s compared to omega-3s over the past 100 years. In fact, at the turn of the century, the ratio of omega-6s to omega-3s was about 1-to-1, in some places 2-to-1. Now in the Western diet, and especially in the diet in the United States, we're at a ratio of 20-to-1. The elimination of fiber, both soluble and insoluble from food through processing, making it more palatable, easier to digest. And a heavy reliance on antibiotics, pesticides, and hormones for maximizing yield and profit. The medical community contribution. This is what we're responsible for, what the doctor ordered. So the advent of low-fat diets was actually introduced by Ansel Keys with his 7-country study in the 1950s. The study in which he looked at the diet and the heart disease rate of 7 countries throughout the world suggested that dietary cholesterol was a risk, not a brisk, but a risk factor for coronary artery disease. And so that prompted the switch to low-fat diet with the substitution of that low fat with high sugars to promote heart-healthy eating. The study tried to answer the question of why some countries had higher mortality rates from heart disease than some didn't. It showed that serum cholesterol, blood pressure, diabetes, and smoking were universal risk factors for heart disease. And these are the 7 countries: Finland, Netherlands, Yugoslavia, Italy, Greece, Japan, and the United States. Healthy diet and exercise would also slow cognitive decline. So we embraced the study. We switched from high fat to actually high sugar. The medical profession supported a low-fat diet to lower cholesterol and cardiovascular risk. Food processing created these low-fat choices and added sugar and other carbs, enhanced carbs, to enhance the taste. So for the next 30 years, we were told to eat low-fat. However, the substitution of more processed food contributed to obesity and to the diabetes epidemic. Dietary changes, misdirection. These dietary changes led to our metabolic dysfunction in our bodies. Excess sugar disrupted the delicate hypothalamic insulin regulatory system and kept our blood sugars in a narrow range. Metabolic dysfunction. So what's that all about? Well, when there's a decrease in blood glucose metabolism, we see that this precedes Alzheimer's disease symptoms by about 10 years. This abnormal energy metabolism is contributory to the cause of dementia. And we also know that type 2 diabetes patients have a 45% faster memory loss and a 29% faster judgment problems as they age. Type 2 diabetes patients, the duration of their illness and the degree of the glycemic dysfunction correlates with the rapidity of their cognitive decline. So that if they don't have good control of their blood sugar, and it's been going on for a long time, this accelerates their metabolic dysfunction and their cognitive decline. So there's a term that they've started to refer to in terms of dementia as type 3 diabetes, and I put a question mark there. We do know that insulin is needed for glucose to be utilized in the brain. We do know that chronic high insulin states lead to insulin resistance, and it leads to decreased insulin receptors in the brain. Utilization of glucose is impaired, excuse me, and the brain is starved of its primary nutrient. We also know that sugar by itself is pro-inflammatory. So what's the cause of high insulin? What is the etiology of this resistance? Well, I love this quote. I'm gonna say it slowly. It is the overconsumption of relatively inexpensive, highly profitable, massively advertised, calorically dense, inadequately satiating, highly palatable food in the industrialized nations that has led to an unprecedented increase in diabetes and prediabetes. So, insulin resistance is actually a physiological response to chronic nutritional oversupply. Dietary sugar more than starch drives the metabolic reaction, which leads to type 2 diabetes. And sugar is made up of glucose and fructose. Glucose drives insulin release, which leads to weight gain. Fructose drives liver fat accumulation, which also drives insulin resistance. And dietary sugar, refined sugar, is only found in processed foods. High fructose. It's a cheaper version of sugar marketed in the 1970s, made by cornstarch. It has a more profound effect on stimulating insulin secretion than sugar. It's contributory to metabolic syndrome. Fructose, which is found in fruit, does not elevate insulin levels like high fructose because glucose in it is encapsulated in fiber and there is a slower release. So food has changed. Our obesity is a direct result of alterations in food. Diminished physical activity in city and urban and suburban dwellers. Our choice, however, is highly influenced by the advertising industry targeting children and the surreptitious addition of sugar and high fructose into packaged convenient foods. In addition, the government subsidizes many of these agribusinesses. They have huge lobbies which drive what is promoted and what is not promoted. How we eat? Fast and furious. Convenient, calorie-dense fast foods, preference for sugary drinks, switching to fried foods and vegetable oil, high heat frying, creating advanced glycosylated end products, which are found when you overheat food and they create inflammation. Lots of sugar, salt, and fat. And sugar effects on the brain may mimic drug addiction. Your supermarket. The game is rigged. The vast majority of foods offered are highly processed, full of additives, nutritionally poor, and lacking satiation. Profit margins are highest in processed foods, and they're usually given front row exposure, eye level. Real food is unprocessed, unadulterated, and only found in the periphery and on the bottom shelf or way up on the top shelf. Insulin and Alzheimer's disease. Does it cause an effect? Well, when there are low insulin levels in the brain, there is diminished insulin receptors. We do know that there is cognitive dysfunction. Insulin is needed for neuronal signaling and to make acetylcholine, which is a crucial neurotransmitter. Insulin plays a role in the formation of amyloid and tau tangles, which are found in different types of dementia. And as I said before, insulin degrading factor is utilized to degrade insulin in lieu of its degradation of amyloid accumulation. The storage supply of glucose in the brain is limited, so when it runs out, there's a reduced brain function. This hypometabolic state of low glucose precedes cognitive symptoms in dementia. When glucose is scarce, it is first reduced in the hippocampus, then the posterior cingulate cortex, and then in the parietal and frontal lobes. So the hippocampus is the area of memory. The frontal lobes are the areas of higher level functioning, usually functioning that takes multiple choices and is very easily disrupted as we get cognitive decline. This slide here shows kind of the similarity between a cocaine user and a sugar user versus a normal brain. Preventing dementia. So these, and again, these are opinions, but food can prevent, cause, or reverse diabetes for most people. Drugs can lower blood sugar, but cannot fix diabetes mellitus. Drugs can help. Diet and lifestyle lower the insulin levels, and we're going to go into that. So how do you reverse this insulin resistance? Well, it's lifestyle and medication. We know that exercise improves insulin utilization and diminishes insulin resistance. We know that losing weight also does that. Utilizing low glycemic foods, real foods, some fasting. So having a period where the body is not dealing with food. And remember, food is a foreign substance. Even though we like it, it actually initiates an inflammatory response in the gut. Bariatric surgery, and that plays into weight loss, and then medication. So medication and insulin resistance. I've thrown out 6 different types of medication here. They're meaningless to you. You might have heard some of them. The new one is GLP-1, the old one, metformin. But the statement and the important thing about these 6 medications is they are all anti-inflammatory. And that is really the key. They actually work on the brain. Yes, they work on other areas of the body, the utilization of glucose, the delayed emptying of the stomach and things like that. But the common factor of all these is that they are anti-inflammatory. So let's look at metformin and Actos. I can't pronounce this either, but I'm just going to say the trade name, Actos and Avandia. They both increase insulin sensitivity. Orlistat blocks dietary fat absorption. It increases insulin sensitivity. GLP-1, glucagon-like peptides, Victoza, Ozempic, everything you've heard on TV and you've heard the catchy tunes. Well, the fact is that these are anti-inflammatory, and glucagon is actually the counter to insulin. So glucagon actually balances insulin. When there is a low sugar state, it stimulates release of stored glycogen, which is a glucose storage mechanism. It increases insulin receptor sensitivity in the brain. SGLT2, so sodium glucose co-transporter. What that means is that in the kidney, this takes the sugar and exchanges it for salt and gets rid of the sugar in your urine. And so that lowers your blood sugar. It also is associated with 11% lower risk of dementia. And it too improves insulin sensitivity. And as I said before, it's anti-inflammatory. Lifestyle, drugs, and dementia. Well, medicine has recognized that in the vast majority of patients, obesity may be a forerunner of insulin, actually insensitivity. And there's good evidence that insulin insensitivity foretells obesity, metabolic syndrome, and diabetes. If we can control insulin levels and maintain insulin sensitivity, this may be the key to cognitive health. Lifestyle and drugs are impacting this scenario. So the four components of brain health, tongue-tied, inflammation and insulin resistance. Number one, when we have inflammation, especially in the hypothalamus, it can be due to poor nutrition and inability to utilize glucose. There is also compromised circulation, narrowing of artery due to the inflammation and the excess insulin that's secreted and circulating. There's also an effect on the blood-brain barrier, leading to toxins and microorganisms penetrating into the brain. And lastly, we know that there is inadequate waste removal and buildup of amyloid beta and tau. So the key is having proper nutrition. Glucose and ketones as primary and secondary energy sources, especially for the brain. Optimal circulating delivery, optimal circulation and the ability to deliver oxygen and nutrients to everywhere in the body. Adequate defenses, a functioning blood-brain barrier and immune system. And lastly, good waste product removal. And all of these things, again, are tied into the inflammatory response, chronic inflammation of the hypothalamus, and the metabolic dysfunction that follows. I have two references. And these books are actually, they're relatively new. One is called Metabolical. So it's a play on words. And the last is called Change Your Diet and Change Your Mind. These are both medical doctors, well-written books. And I'm happy to take questions. It's kind of a complex topic. I hope I didn't throw too much at you, and so that you're able to digest some of it. Thank you.
Okay, I'm keeping this off. Sorry about my camera, but thank you, Dr. Grossman. Oh,
You're welcome.
very interesting. We have a couple questions. Let's see. Talking about anti-inflammatory foods, is chicken considered anti-inflammatory?
It's kind of in the middle. It's not really anti-inflammatory. Lean protein is probably neutral. Fatty animal protein is probably somewhat inflammatory. But again, and it also depends on how you cook it. So obviously, if you don't deep fry it, that decreases the inflammation. the things, the most anti-inflammatory of foods are the omega-3s, which are found in fish oil, and some other oils also found in fish, and then fiber, which is found exclusively in plants. So lean protein, especially fish, can be anti-inflammatory. It's really how you cook it and how it's digested.
Okay, thank you. Um, and then another question is, let's say you're having some metabolic issues and having some inflammation. How long could it take to reduce the inflammations if you were to make changes in your diet?
So it takes about 2 weeks to change your microbiome, your organisms in your gut. And that has the profound effect of decreasing the inflammation. So about 2 weeks, maybe a little less, maybe a little longer. And again, it can be a gradual process. But there is good documentation that, and they've shown studies of checking people's bacteria, putting them on a diet, they change within 2 weeks, putting them back on a different diet, they change within 2 weeks. So you can accomplish this within 2 weeks.
Okay, thank you. Let me see. Sorry, I'm just looking through the questions. The slide that talked about too much insulin versus not enough. Can we talk a little bit more about that?
Okay. I think which one that was.
It was before the one showing the cocaine and the sugar, the brain.
And the brain, okay. I will look, let's see, cocaine and sugar. Well, the slide before was insulin and Alzheimer's disease.
Yes.
So what happens with high insulin is that the body actually adjusts and decreases the amount of insulin receptors. And so the end result is that without insulin receptors, glucose, which can get into the brain without anything, unlike muscle, is not utilized because it needs those insulin receptors. So even though you have high insulin, there is a change in terms of downgrading because there's so much insulin around. It actually decreases the number of receptors, and that leads to less availability of sugar as a brain food. And it sounds a little bit backwards, but that's how the body reacts by excess of insulin.
Thank you. And then someone is wondering if metformin could help preserve cognition.
Yes, so it has been shown that seems to be the miracle drug. It's been utilized for lots of things. And again, it's an old drug. And we think of metformin as somehow working on the gut and the absorption. But in fact, it also works on the brain, on the hypothalamus, and on inflammation. So yes, indirectly, it can improve cognition. There's been some studies, and again, I think these are hard to discern the total result, but there has been certainly some inclination that there is benefit there. There's been benefit to a lot of these, especially the GLP-1s, to a lot of things, heart disease, obviously weight, but heart disease, and they've also shown that that has improved cognition. So we're not sure the mechanism. I believe the mechanism in some way has to do with its anti-inflammatory and its direct effect on the brain. And metformin and the GLP-1s, the Victosas and the Ozempics, they actually, people say that they're not as hungry, and that's a brain thing. Okay, so there must be some effect on the brain.
Thank you. And that was all for our questions today. So I just want to talk a little bit about our dementia navigation program and who to contact. We have Hannah, our manager and care navigator. We have Nicole Hale, and then we have me, Cassie. You could call any of us if you have questions, need more information, need resources. Please do not hesitate to reach out. And next. Um, who to contact with concerns. We have Dr. Elizabeth O'Toole and Dr. Botros are two of our geriatricians in our program. They come here to Allison's Place Clinic and do geriatric assessments and see our clients. Two of our other presenters, well, we have Carol Klingler. She's one of our presenters in the Brain Health series. And then we have Pamela Lynch. She runs our Caregiving with Confidence class that we offer. It's a 6-week course for family caregivers to just help walk them through caring for someone with Alzheimer's or dementia, go over different behaviors, experiences they may have and how to handle them. Next. Additional resources. I just talked a little bit about our Caregiving with Confidence workshops. Our next one starts next week, November 6th. If anyone's interested, please reach out to us to sign up. We have a dementia support group every second and fourth Tuesday of the month at 1:30 on Zoom. We have our care navigation program. We have our brain health and wellness once a month with different presenters and different topics. We have started a memory cafe. We're now having twice a month for a family caregiver and their loved one to come do something fun for a couple hours. We have music therapy a lot, make different snacks, different presenters, exercise. It's a fun 2 hours. For any information on this, please reach out to us. And then our next webinar will be Navigating the Holidays with Dementia, Tips for Less Stress this season. And that will be November 21st from 6:30 to 7:30 with Carol Klingler presenting. Thank you, everyone. Thanks for attending.